Thank you, Rosamund. So what are the simple public health actions that employers can put in place to protect their employees or their business partners?
Sure, Alexandra. So in the first instance, the public health actions that the employer can put in place are the same as for everyone else. The number one action is hand washing. This can be done with soap and water, and it can be done with hand sanitizers, alcohol-based hand rubs. To do that as often as possible, certainly before eating, before or after handling maybe door handles or elevator buttons, things that are touched frequently by other people, especially during the winter months in the Northern Hemisphere or likewise in other parts of the world. It is from these frequently touched places that people can acquire viral infections. So it's really important to wash your hands, but equally important not to touch your face afterwards. Before, when your hands may be dirty. So what people don't realize how often we touch our faces, our nose, our eyes, and so it's really important to just try and remember to control that impulse. Keep your hands clean, don't touch your eyes, nose, or your face, or your mouth, and keep a distance from anyone who is coughing or sneezing.
Thank you very much. Are there any actions that employers should do if COVID-19 arrived in their communities?
Absolutely. Because this is an infection that can infect almost anyone, there's some things that are important to know. One is that still, most people who acquire this infection actually have a very mild illness. And that's just to reassure you that it can be very serious in some people, but most people have a mild case. So for those where it is serious, it tends to be the older folks. As we get older, we are more vulnerable to all kinds of infections, and this is no exception. So employers can provide information to employees through a whole range of means. So one is posters that you can put up in your workplace, communication messages through email, this kind of information medium through social media. And also what's really helpful is to have perhaps a talk in your workplace, depending on the size of your workplace, either from your occupational health and safety support office or from your staff health services. If your business is small and you don't have that kind of support, you can reach out to a local healthcare provider or to your local public health unit. There are many professionals in the community who'd be probably happy to help with this.
Thank you very much. So once again, just a reminder for everyone, today we are talking about COVID-19 in workplace. So feel free to ask your questions to our expert, Dr. Rosamund Lewis. Can you also explain to our viewers, please, what if someone needs to go on a business trip? What are the actions to take, or what is the information they need to know?
Absolutely. So there are things that you can do. First of all, what we're saying is that you need to assess the risk. So is this business trip necessary? What is the location? Has COVID-19 been reported there? Is it possible to hold this meeting through any other means, whether it be video conferences or teleconferences? If the person needs to go, then there are means to protect the traveler by preparing them before the trip, during the trip, and when they come back. So before the trip, you want to make sure that they have the maximum amount of information available, the latest information available on where COVID-19 is being reported. Of course, busy places like airports or train stations, they can of course pose a slightly higher risk. So it's really all about managing that risk, being prepared, being aware, and then when you're in a destination, make sure to follow the requirements or the recommendations of the local authorities. They can be public health authorities, they can be security, police, but when you're somewhere where a situation may evolve very quickly, be aware that you may need to follow the instructions of the local authorities. It's not necessary to wear a mask. I'm sure many of you will be interested in that. The mask is really mostly helpful for people who are already coughing because it protects other people from the results of that cough. Most of the masks that are out there right now, the thin surgical masks, they don't really protect directly, and it may be that we are using too many masks because who really needs the masks is the health workers, the nurses and doctors who are treating people in hospital. So we recommend that you use a mask if you're already sick or if you're looking after someone who's sick, but otherwise we're not recommending masks in the general sense.
Thank you very much. We also meanwhile received a question on masks. If you can just clarify as well, not when traveling but in the workplace, that maybe community is affected by COVID-19. Do you still recommend that employees should all wear masks or not?
Now remember that COVID-19 is one type of infectious virus. There are others. There are common cold viruses, we could name a few, there's the flu season. These are all infections that spread in a similar way for the mechanisms that we've already talked about. So it's important if someone does actually have symptoms, whether they have a cough or fever or runny nose, that ideally they would just stay home. If they're not that sick, you could offer that they telework from home. Ideally, they would not be in the workplace where they can infect others. If they are in the workplace, then again, if someone is actually having these kind of respiratory symptoms, we would suggest that that person who's not well is the one who's wearing the mask, not everyone else. And there's another reason for that, is that we've seen that when people wear masks, it's unusual, it's uncomfortable, it's not something they're used to, and in fact, you may be ending up touching your face more often than without wearing one. So you maybe want to adjust it, and then of course, by the time your mask become damp, in fact, that mask can spread the infection even more easily, especially if it's not put on properly, removed properly, disposed of properly in a closed bin. So we don't want to cause greater risk by everyone wearing masks for long periods of time. So if you are going to use one, then please do check what is the right way to wear it and the right way to dispose of it.
Thank you very much. This was really great explanation. We are getting more and more questions, and here is one from Laura Patricia Lopez Meneses. Are there any special recommendations for employees from airports?
Well, that's a very good question. So an airport is a workplace like any other, and again, it's about risk. So what is the risk in your workplace? What is happening in your community? And clearly an airport or a train station may be a place where more people are passing. Now, if you're just passing someone, if it's not that crowded or you're not that close, just passing someone in a shopping mall or in an airport is not something that's going to increase your risk. But if you are at the front lines and you're actually screening passengers who are coming, you are approaching them, you are taking their temperature perhaps, or you're asking questions, and you may be just less than a meter, or hopefully not less than a meter, you want to be mindful that you may wish to wear a mask in that situation if you think you're coming in contact with people who you are screening, especially if it's likely that the contact may be reduced to less than 3 feet.
Thank you very much. We have a next question from Estemarie Luna Vargas from Dominican Republic. What's the best way to practice prevention in a call center setting where headsets are shared and facilities are closed and air is recycled?
So, another very great question. So in a setting where you may be constantly touching surfaces, we didn't talk a lot about surfaces yet. So when somebody coughs or sneezes, the droplets may drop on whatever's in front of you, whether it be your desk, a table, a telephone. And so in those circumstances where you are likely to be touching surfaces, especially if they've been touched by others, that you want to do everything in your workplace to keep those surfaces clean. So regular disinfectant with just ordinary kitchen disinfectants, chlorine, that sort of thing, really simple things. But doing it regularly is the important thing. So making sure that your desk and surface area is clean. If you're coming into a workspace, a booth maybe that somebody else has been using, you want to be careful. You don't want to be too worried, but you want to be careful. Then feel free to use wipes or regular disinfectants to clean the surface.
Thank you. There comes a question from Sergio Lopez Lara. What is the recommended frequency for wiping surfaces with disinfectants?
Again, there may not be an absolute answer to that. It may be, is it your workspace? Maybe you do it at the frequency that you're comfortable with, once a day, twice a day, once every 2 or 3 days. But if you're sharing that workspace with other people, then how frequently is that workspace exchanged? And have you seen anyone in the vicinity coughing or sneezing? You don't necessarily want to wait for that, but if it's a heavily trafficked workspace, then you might want to do it more often, maybe several times a day.
Thank you very much. Here's a very good next question. What about library where people are borrowing books?
So books are a type of surface which, first of all, if they're on the shelf and they're there for several days or weeks or months, then most of them are not likely to be infected in any way. Secondly, they won't also be infected if there's no COVID-19 in your community. So unless there's COVID-19 in your community, it's not something you need to worry about at all. And finally, books tend to have, if it's more of a porous surface, it's possible that the virus doesn't survive as long on that surface. If you are really concerned, you can wear gloves. If you're dealing with materials that you feel are being touched often by others, you could wear a pair of gloves, but again, be very careful. When you remove those gloves, first of all, don't touch your face with the gloves, and secondly, remove those gloves carefully and bin them in a closed bin so that you're not reinfecting yourself from the surface of the gloves. But in most cases, you wouldn't need to worry about this. There's still relatively few cases around the world. We are seeing outbreaks. We're seeing outbreaks in specific countries, and we're seeing a sporadic case here and there. For the vast majority of you watching this right now, it's not something you should worry about.
Thank you very much. We go on the next question from a viewer on Twitter who says that he works with clients with poor respiratory hygiene. So his question is, what should he or she do?
With the clients?
Yes.
Well, it would be helpful to know why that person has, what type of client. So I don't have the answer to that question, but depending on the type of client, if it's someone who maybe is ill or coughing and you have no choice but to be in very close proximity to them, you may want to share with them the fact that you don't feel like shaking hands because you're concerned about what's happening right now, but don't be too worried. Just say that right now you're not shaking hands with anyone. Or you might say that we appreciate if we just keep a distance of a meter or so, or you may wish to place your client across a table from you, and you may wish to limit the time that you're with them to a shorter period of time. And really, as I said before, for most people, this is not a concern, but definitely there are other viruses that can be transmitted in this way. So those practices are always good. You can ask them to cough into their sleeve. We haven't talked about that yet either, that when people are coughing or sneezing, ask them to do this. You do not want to cough into your own hands and then go and shake someone else's hands. That is a no-no. You really have to protect others from your own cough and sneeze, and you can politely ask others to do the same.
So let's just summarize here what are the main ways of protecting ourselves and others from getting sick. What hand washing, and so what are the other tips you recommend?
Right. So absolutely hand washing, absolutely keeping your hands away from your face. You may use a Kleenex if you're not comfortable with the elbow, but if you do that, bin the Kleenex immediately. Don't leave it lying around. Keep your surfaces tidy and clean them regularly with disinfectant. These are many ways in which you can protect yourself. And for the workplace specifically, really, if you are an employer and you're watching this, you should consider what are the risks in your office. What is the traffic in your office? What are the offices like? Are they cubicles? Are they closed offices? If it's an office, it could be a different type of workplace altogether. And then manage the risk accordingly by informing your staff and your clients, of course, yes, of these simple measures that really will protect all of us. Of assessing the risk that you have when people are traveling for business or even traveling for family reasons. They want to be aware before they travel, when they travel, and also when they come back. They want to be aware of any risk they may have been exposed to, and go and discuss it with your staff health or occupational health services. And then you want to also consider maybe having a preparedness plan or a business continuity plan, because if COVID does arrive in your community, you may be now listening to your health authorities say, okay, we need to maximize the number of people that are staying home for whatever reason, or you can't travel in and out of a location. Again, this is not happening in very many places. But it would be a good idea to start working on a business continuity plan so that you can have policies in place. Who can telework? When should they telework? And various things like that. Do all people need to be in at the same time? Can the work be spaced out? And it may depend if it's a manufacturer, it's a different situation. But again, lessening the number of people that are coming and going, especially in a circumstance like that, can be very helpful to reduce the risk for your office and your company.
Thank you very much. I think we have a very relevant question coming from Ruder Avenado Buluran. He says that a lot of employees are commuters, and it worries them especially as they don't know who they encounter with while they commute. And then the question is, should companies activate remote working if available instead of wait for a worse outbreak?
So there's two quite different questions there, because we just talked about remote working. I'll address that one first. So the remote working, it's up to the company policy. You need to know what is the comfort level in your company. But if it's something that you put in place ahead of receiving COVID-19 or another infectious disease in your community, then it's something that you can practice. You can work on it, people get used to it. Managers especially can get used to having their employees working from a distance. You can fine-tune those policies so that when you do have to implement them, if that becomes the case, then you're actually more comfortable doing so. So practicing that and having policies in place in advance of any emergency is actually a really good thing. Then the second question was about public transport. So for public transport, it's a concerning question because you are there in a bus or a train and you feel that you're crowded in. But the same rules apply. If you're touching the pole, of course we don't want you to fall over and have an accident. So by all means, make sure first that you're safe and secure. So hold on tight, but then don't put that hand to your face. Keep it by your side until you get home and wash your hands. Or you can have a little bottle of sanitizer, or you can have wipes in your pocket. And if you feel that you've exposed yourself to an unhygienic or frequently touched environment, then you can deal with that straight away. So that's a good plan. And then in terms of crowding, that's up to you as an individual to decide, are you getting on that bus or you're not getting on that bus? But of course, if you are on the bus, make sure that you protect your own cough with a tissue or with your own elbow, and protect the others around you, and just try not to be close to someone who is coughing, or ask them quietly to do the same, to protect others by coughing into their elbow.
Thank you very much. Here comes in the next question. What's your advice for employees who have business meetings in affected countries?
So this is a very good question. Whether to plan a meeting or not is an important question. So the first question, of course, for the employer is, how important is this meeting? Does it need to go ahead? The second thing is, how can this meeting be held in a way which reduces risk? Because remember, we're just managing the risk, and the risk may be very close to zero, but it's never zero. So how do we manage that risk? You can manage it by having some people telework or video conference in. You can manage it by having a webinar. If you're going to have it by having a meeting in your premises, it depends on the size of the meeting and how many people are attending. A really good practice is simply to make sure everyone knows where the washrooms are, make the dispensers of the hand sanitizers available at strategic locations. You could have your staff health services come in and give a 2-minute talk at the beginning of the meeting to say that you're all aware that there's a situation in your environment, and these are the practices that we're going to be put in place during the meeting so that everyone is protected. And then, of course, the important thing is, part of your preparedness plan should be to know who to call should you have any concern, what to say when you call. So it's good to plan this in advance. If you're having a meeting, by all means, go ahead. Contact your public health authority or your health services or your healthcare provider in advance to say, here's what we're doing, what advice would you have for us? Or maybe you can just find it on their website. What advice would you have for us if we have a situation and we need to call you? If you do have a situation, has that question come up yet?
No, not yet.
If you do have a situation and someone in your workplace is unwell and they're coughing and sneezing and you don't really know where they've come from, or you do know where they've come from and you're concerned, just make sure that part of your plan is to have a location where you can put them. It could be apart from the others. It could be someone's office, it could be a nursing station, it could be a location where, just so that managing risk, remember, is also managing the perception of risk. So you're not just managing the actual risk, you're managing how people feel, how they react, what they think. And so your best move is just to have a place where you can ask someone to sit quietly, depending on how ill they are, and know how to handle that situation while everybody else just goes on with their business.
I'm taking a message here that actually employers have an important role as well about in communicating with their employees the risks, right? Thank you. We have a next question. What is your advice for social workers who are exposed in poor communities?
Someone who's working in a poor community may be exposed to a different type of environment, but basically it's the same situation whenever you're working with someone. If you feel that there's a situation that is evolving, that you need to call someone, know in advance who you're going to call or what you're going to do. I think that our emergency services certainly will be fully trained, paramedics and emergency vehicles will be fully trained as to know what to do. But most of the time, there's no reason to suspect that there's any higher risk in a poor community than any other community. Everyone, it can be equally affected, and the vast majority of people right now are not at risk at all. So it's the basic common practices of protecting yourself and helping to protect other people, so that you're not coughing on them and they're not coughing on you, and that would be the number one thing. Again, hands, don't touch your face, keep them clean, and you can protect yourself and the people you're working with, whatever community you're in.
There is a question as well, how are cleaning workers being trained to properly clean and disinfect surfaces in the event of a broader outbreak?
So that's an important thing you need to consider in your preparedness plan, and in fact it should be a discussion that you're having already with your cleaning services as to how are they actually doing it right now. Are they doing a good job of cleaning surfaces? You have concerns? Let them actually just describe to you what they're already doing. And then have a conversation with them, because after all they're the professionals. And so they should be able to advise you as to what they think they can do differently if they need to ramp things up, or just have a conversation so that you actually know. Because the biggest source of fear is the unknown. And if you don't know what your cleaning services are doing, then it's a good time to ask them.
Thank you very much. We are getting several questions on what about gyms where everybody is touching everything when they are doing their training.
So one of the things about this disease that I feel that it's important to share with you is that what we have learned is that when people are becoming ill with, and I'm going to talk about COVID-19 right now. I mean, there are different infectious diseases out there, as we've already mentioned several times. But for COVID-19, what we've learned is that the onset, the beginning of the illness can be very mild. It can be a low-grade fever. It can be a dry cough, a slight cough. And so when people are, if someone is becoming ill with this, it can be quite mild to begin with. And in fact, they can be out and about, they can look well to other people, they may take medication to make themselves feel better, and they may continue going about their business. So this is something specific that we've learned about this illness, that people can have mild symptoms and transmit. So the important thing is not to worry over much about this, but to realize that even if someone is only mildly unwell, they could still spread it if they have it. Of course, if they don't have it, they can't spread it. But if they have it, this is a situation. So it is a possibility, there is a chance that somebody could still be well enough to go to the gym and so on. Again, what is the situation in your community? Has anything been reported in your community? And number two, standard practices. If you're working at a gym, that's fantastic. It's great for your health. Keep it up. Just keep your hands clean. And don't touch your face when you're working with the gym. Go straight to the locker rooms afterwards and clean up, and then you'll be fine.
Thank you very much. We have a question coming on, what about the situations inside the plane, both for flight attendants and passengers? Are there any special recommendations?
So there are special recommendations. They're already online on the WHO website, which is www.who.int. So this work is being done not alone by WHO, but in conjunction with the International Air Transport Association and other industry leaders who are already making information available to specific cadres of workers. And the airline industry is obviously one of them. So the airlines will all have their methods that they're putting in place to protect their workers as well as their passengers.
Thank you very much. Rahul Pradhan is asking, does good air circulation reduce risk of COVID-19 transmission in a workplace? If yes, would open windows be better or use of AC?
It's a good question. We don't think at the moment that COVID-19 is being transmitted through ventilation systems. It doesn't seem to be the main driver of the outbreaks. The outbreaks are being driven primarily by person-to-person, direct person-to-person transmission through respiratory droplets. So ventilating an open space is always a good idea. It's always a good idea to have fresh air coming in. Probably open windows are just fine. There's no need to have air conditioning on specifically. And again, the same measures apply.
Thank you very much. Jenny Weber is asking, can infected persons spread the disease when they are touching items around us, for example, a credit card machine at our local store or when they're checking out?
So the concern about the spread of the virus on surfaces is a legitimate concern, and it's what everybody's worried about. Again, things that are frequently touched could hypothetically be a source of concern. Right now the virus, what we know about it, which remember this didn't exist 8 weeks ago, so we're learning a lot and we're learning fast. And we're sharing everything we're learning with you. But sometimes we may say we just don't know. So at the moment what we know from a study and from comparison with other coronaviruses, because there are other coronaviruses out there, not just this one, is that this virus can survive on surfaces for a few minutes, a few hours, or in certain circumstances, even up to a few days. This is not to worry you, but just to remind you that it is hypothetically possible. We are not seeing a huge amount of transmission through that route, spread, I should say, through that route at the moment. But again, don't be afraid. Go about your business. As long as you wash your hands and don't touch your face, you will not be transferring anything from the surfaces around you to your orifices, right? Your mouth, your nose, your eyes. This is what you don't want to do. You don't want to transfer anything from a frequently touched surface to your face. So the main messages are, if you're touching surfaces, just wash your hands afterwards and keep your hands away from your face.
Thank you very much. The next question comes from Mario Vera. What are the measures someone can take if he or she works in a church?
A church is indeed a workplace like any other, and if you're working in a church, it would be the same. So you have areas in your workplace which may be frequently touched by the community, by other workers, and you want to know what those are, and you want to have maybe a system in place for cleaning them as often as you feel they need to be cleaned, but at least consider what are the frequently touched surfaces and keep those clean. As for yourself, the protection is the same. Keep your hands clean.
Thank you very much. We had a lot of questions on different workplace settings and how to protect ourselves and prevent infection from spreading. But there is a question, what shall we do? Should I stop going to workplace if someone is sick at my work with the COVID-19?
I think if someone is sick with the COVID-19, they would not be at work. You wouldn't know that someone has that. Lots of people have the sniffles right now during certain parts of the world with flu season and so on. If someone has COVID-19, they will not be at your workplace, because if they know that they have it, that means they've been tested and they're positive, and they will be immediately isolated by the health authorities at home or in a different facility or in a hospital, depending on their level of well-being and health. So you needn't worry about having other people in your workplace who may be infected. But again, it may be in the early stages if you have it in your community, or if someone has traveled from a location where COVID-19 is being reported. Be aware that people can come back to work. We have at WHO received our international team back from China. We have our colleagues who are going around in our workplaces, and it's because it's not it's transmissible person to person, but through close contact. So we are not concerned about people coming back from those locations, but we do have to be very mindful. And those people who may have been exposed, if it's in the community or through travel, must be very aware that if they start feeling the slightest bit unwell, they need to immediately go home or report to their health services and let someone know. The important thing is to let someone know. Don't let it drag on, right?
Yes, thank you very much. Is there any specific advice for employers when one of their employees is found to have a COVID-19?
If your employer is your employee
Yes.
is found to have it, well, again, it's the same situation. In this case, what you're dealing with is if an employee has already been identified as having a case, then there's some things that you can expect to happen. The first thing that you can expect to happen is that your employee won't be at work anymore. Somebody will have already told them to stay where they are or to report to a hospital. So that employee will not be at work anymore. However, what we're trying to achieve right now with these imported cases and outbreaks in different places is what we call containment. So in order to contain a new outbreak, what we're doing is public health authorities around the world are doing what's called contact tracing. So if someone has been identified as a person with this illness, then the public health authorities will interview everyone in their surroundings. They will interview their family members. They will interview, yes, their co-workers, and they will ask about the extent and degree of contact. They will interview people that might have gone to the nightclub with the night before. They will try and trace all of the contacts of that person who is ill. So what you can expect is that you may be interviewed and you may be asked questions. But the important thing as an employer is to reassure everyone in your workplace. It's not because someone has been in the workplace until yesterday that you are necessarily at risk. But again, if you think you've been exposed to someone who may have this illness, then you need to be very mindful yourself of the slightest feeling of being unwell or fever or dry cough. Those things as they appear, don't tough it out, don't go to work, call your employer, let them know your situation, what your concerns are, and ask them what you should do. You can call your healthcare provider and you can call your local public health authority to ask for advice.
Thank you very much. There is another question, how to deal with people who recovered from COVID-19 and come back to work?
So at the moment, from what we know, is that people who do have this illness are recovering. Most of them are recovering. And however, they will be unwell for a period of time, maybe some of them. Some of them may be, as I said before, not very greatly affected at all. So what the health services are usually doing in these situations is basically, where it's possible to do so, is to test the person. If they have been confirmed to be a case of this new illness, then they will test them until they are negative. And once they are tested and they are negative, then usually they are released either out of hospital or back to their communities. And many people around the world have already been released, so to speak, from the health services where they were or allowed to return to work because they have tested negative.
Thank you very much. And how about pregnant women? Are they at higher risk and should not work anymore?
So pregnant women are not considered at the moment to be at higher risk than other people. As I said earlier, we are learning all the time. And anyone can be at risk, hypothetically, if it's in your community. Luckily, what we have learned so far is that there does not appear to be a greater risk for infants who are born to pregnant women who have had the infection, because we have seen a few. Nor is there a great risk for children. One of the interesting things about this new illness is that children seem to be mostly spared. It's interesting that kids don't get very ill, they don't get infected at the same level as adults. As I mentioned earlier, the risk of more serious illness increases in the older age groups. So for employers, many of us over the age of 30 or 40 or 50 or 60, as we age, our risk of having more serious illness is in fact higher. So it's in the interests of the employers to protect their workplace because they are also protecting themselves. But for pregnant women, there's not a particular concern at the moment, and children seem to be spared.
Thank you very much, Dr. Rosemond, for all great advice you gave us today. And I would like to thank everyone who was watching us today from South Korea, Portugal, Mexico, Brazil, India, Lebanon, Pakistan, Vietnam, Nepal, South Africa, the Philippines, Thailand, Malaysia, Saudi Arabia, Cambodia, United States, Bhutan, Greece, Ghana, Tanzania, Angola, and many others. As Dr. Rosemond said, every day we are learning something new about this virus and we are sharing with you. So please continue following our social media channels for the latest updates, facts, and how to protect yourselves and your loved ones or in your workplace. Also, don't forget to check our website, www.who.int. Thank you very much and keep yourself safe.
Thank you very much.
Hello, my name is Nika Alexander. I'm a communications person here at the World Health Organization. Today we're going to talk about clinical management for people who are sick with the new coronavirus, with the novel coronavirus. I won't be doing most of the speaking. It will be my colleague, Dr. Janet Diaz. Janet, do you want to introduce yourself?
Hello, everyone. My name is Janet Diaz. I'm the team lead for clinical management at the WHO Emergency Program.
And so clinical management means how you care for a patient who's sick, right? It's the treatment. So this could be a very specific kind of conversation we're having today for healthcare workers, but we want this to be interesting both for healthcare workers and for the general public. So hopefully it will be of interest to anybody who wants to learn more about this disease, but it really is more about that specific topic of how patients are cared for. So this is a new disease. I want to timestamp this a little bit. We're recording this on the 1st of February. At the moment, there are 12,000 cases of the disease in China, 12,000 cases in China, and 130 cases in 23 other countries. So it really is centered in China at the moment, but people are working together to learn more. So how do you learn more about a disease which at this point is 1 month old? We've only known about it for 1 month.
Well, it's a challenging situation, but with the WHO, we have established a global clinical network. So we are in touch with at least twice a week, but more so by email, on a large teleconference calls with clinicians that are actually caring for their patients, clinicians from China, from Wuhan, from Shanghai, as well as clinicians from France and the US and the other countries that have been caring for patients. And it's an opportunity for everyone to share what it's like to care for those patients, what they're doing, what they're presenting with, what their symptoms are, what their complications are.
And so what do we know? What have you learned so far?
So it seems that at large that the disease is leads to a mild illness. So most patients are mildly ill, which means they have maybe a fever, cough, sore throat, muscle aches. But there is a percentage that does get severely ill. We think it's about 20%, but we will see those patients go on to develop severe pneumonia. They can also develop dehydration, respiratory failure, which means that they would need a breathing machine to help them continue breathing, and there have been deaths.
About, at the moment, what we understand from Chinese authorities is about 2% of the people for which they have information, 2% of the patients in China have died. Is that about right?
Yes.
Okay, so that, again, timestamp for this time. This is 1 month after we've known about the disease, and information may change and evolve as time goes on.
Exactly. I mean, I think for those, there's patients that remain in hospital, so we have to see what their outcomes will be after being in the hospital.
So that you just summarized what we do know. So for most people, it's a mild disease, about 20% severe, and about 2% have died. What do you not know? What are the questions you're trying to get answers on?
Well, we also have an idea that those that have died with disease tend to be of older age and have chronic other medical conditions such as diabetes. But we would like to have a better understanding of that, so that's what we need to know. So truly, what are the risk factors for severe disease? What are the risk factors for death? We also need to know what treatments would work, what antiviral treatments would work for this novel coronavirus.
At the moment, there is no specific treatment. There's not an existing medication that you can pull off the shelves and say this works for people who are sick with nCoV, with the new coronavirus.
So with this new coronavirus, we have no known effective antiviral therapies. There are some that have potential, we think may work, but we have no known effective antiviral therapies.
So what do you do? What are these doctors that you're speaking with in China and elsewhere, how are they treating these patients?
So because the patients that are mild at large, that they have self-limiting disease, which means they get better with some time, so they get treated with symptomatic treatments such as paracetamol for fevers. Or for those that get sick in hospital, then they require supportive care treatment. So this may be on the hospital ward or in the intensive care ward. That would mean if you have pneumonia and you need oxygen therapy, you get oxygen therapy. If you need IV fluid therapy, you get intravenous fluid therapy. If you are suspected to have an infection, a co-infection, so in addition to the novel coronavirus, a bacterial infection, which can happen, then we give you antibiotics. And if you develop respiratory failure, you go on mechanical ventilation.
So I just want to be really clear on this antibiotic side, because this is a virus. You can't treat viruses with antibiotics. But as you said, if the person has this virus and a bacteria, you give them the antibiotics to treat the bacteria.
Exactly.
Okay. What are we doing then to find a specific treatment?
So WHO is working nonstop with global experts. We have the R&D blueprint, which is accelerating research during outbreaks. And they have assembled multiple also meetings, teleconference meetings with global experts on research. And there are two main outputs that will come out of that. One is the prioritization of potential therapeutics. So based on the evidence, what therapeutics that are out there or in pipeline, in development, should we use in a clinical trial? Yeah, focus on, use to treat patients. And the second aspect is a development of a master clinical trial protocol, which is the best way to test new therapeutics for efficacy and safety.
So for a general public, I just want to simplify the language a little bit there. You said WHO has an R&D blueprint. It's like a group that works on research and development, if that sounds right.
Yes.
And then what is a clinical trial in this context? I think before I came to WHO, I thought a clinical trial was about chemicals and pipettes and whatnot, but it's actually establishing a way of some patients treated with this, some patients treated with that, and then comparing their outcomes, or how does a clinical trial work in this context?
Yeah, I think what you've described is true. So what we are doing with the global experts is developing a master protocol which has clear protocol on how you use these new therapeutics because they need to be tested. Patients will get randomized into one treatment group or another treatment group depending on what the final protocol determines. And
that's about how it works. And consent's always a question people wonder about as
Oh,
well.
of
If
course.
someone's in a trial, do they give their agreement to be part of that? But these trials are always reviewed for ethics, and there's a consent.
Oh yeah, so
component as well
any
for that as
clinical trial has informed consent involved in ethics approval at the country level. So we're in the early phases, so we're developing the master trial protocol with global experts.
Okay, that's the stage we're at now. We're going to wrap up soon, but what would be your advice, Dr. Diaz, for healthcare workers who are watching and who are interested and want to know what to do if there's a patient or they think somebody might be a patient with this disease in their healthcare setting?
So I think to start off with, it's important to get familiarized with the WHO website. It has a lot of useful technical guidance documents to inform about the disease and how to treat the disease and how to prevent the spread of disease. For those of you that are actually healthcare workers or if you're a patient, I think the most important thing is to recognize a potential person that may have novel coronavirus. We have the case definitions on the website, so you can read those and you post those in the clinic, and then you know. If you suspect someone may have the virus, then quick action is to isolate and prevent further spread of the virus, and we have guidelines on that. And then if someone is very sick with the virus, with the severe complications, then initiate supportive care treatments like I described before.
So this is for healthcare workers. We're not saying members of the public should be identifying people who are sick, and this is really for health workers.
I think for members of the public, if you develop a fever, cough, or shortness of breath, then you must seek medical care. And, advise if you have traveled to the affected areas.
Yeah, thank you. So that's, at the moment, as we said, the 1st of February, when we're recording this with the knowledge we have now, the outbreak is mostly in China. The vast majority of cases are in China. The cases in other countries have a travel history or link to China, again, mostly. And as Dr. Diaz said, for the focus is really on people in China to listen to what the national health authorities are saying and when you should go to a healthcare center versus staying at home, because sometimes the disease is mild. And then for people elsewhere in the world, fever, cough, and difficulty breathing, you should seek medical advice on what you should do next. Is that a good summary?
Yes.
And you mentioned that more information can be found. That's at who.int. We're improving the website, adding more information as we go along, but there is information for if you're traveling, protective advice for yourself, and there's a lot of guidelines for ministries of health and health workers and so on. So thank you so much for watching today, and thank you for being with us. One more I should add is that this is more of a general kind of discussion we had, but we're also WHO's developing courses and has more detailed information really for healthcare workers that is more specific and really meant for you and to help you in your work. Thank you very much, and check back often for more information. Bye-bye. Thanks again.
Thank you.
In this live interview, it's my pleasure to have our expert on COVID-19, Dr. Maria van Kerkhove, who will be responding your questions. So please feel free to ask anything you want to know on how to be safe from coronavirus and how to protect others as well, and Dr. Maria will respond. Before the questions come in, thank you for being with us here, Maria, today.
Thanks for having me.
Just to mention that most of our colleagues are teleworking these days. It's few of us who are coming in the office to inform the public on what's going on the outbreak, but majority of the organization is working remotely. Maria, before we get new questions, would you explain to our viewers what is COVID-19?
So thanks for having me, Alex, and hello everybody out there. So COVID-19 is a virus. It's a virus, it's a coronavirus that was newly discovered in December of last year. And I say this is new because we don't have any documentation of this virus circulating in humans before December. It's a coronavirus, which is a virus that mainly comes from animals. It circulates in animals, and some of these coronaviruses will spill over into human populations. There are other coronaviruses like SARS, which is severe acute respiratory coronavirus, or MERS, which is Middle East Respiratory Syndrome coronaviruses. Those viruses spilled over, SARS spilled over in 2002 in China, and MERS spilled over in 2012 in Saudi Arabia. This novel coronavirus, COVID-19, was first identified in China in December in a cluster of people who had pneumonia.
Thank you, Maria. Can you explain to our viewers as well how COVID-19 spreads?
So COVID-19 is a virus that causes respiratory disease in the people that it infects. And the way that it spreads is through droplets, which are little tiny droplets of liquid that will come out from your mouth or your nose when you cough or you sneeze or you speak. And the way that it transmits is that if you sneeze, the droplets will move across to another person and can go into your eyes or your nose or your mouth. And so it's important that you keep a distance. You can see, the viewers can see that we're about a meter apart from one another, because when these droplets come out, they only go a certain distance and then they settle down. And the second way that you can get infected is through what we call fomites, which means that these droplets, when they come out of your mouth and they settle onto surfaces. They might settle onto a table or onto a chair. And if you touch that surface that's contaminated, and then you touch your eyes or your nose or your mouth, you can get infected with the virus that way. So it's really critical. I hope your next question is going to be, how do you prevent yourself from getting infected? It's really critical that you wash your hands, because even if the virus is on your hands, you can wash your hands with soap and water and it will kill the virus. And if you don't have soap and water, you can use an alcohol-based rub.
Thank you, Maria. I'm glad that you mentioned hand washing as one of the priority actions that we all can take to protect ourselves, but also others from coronavirus, because at the moment it's ongoing challenge that we launched on Friday, Safe Hands, and we are inviting all TikTokers to join our challenge and show us how you are making your hands safe. Are you hand washing or hand rubbing or both? Please follow our videos as well and join the challenge. Maria, so what are the ways to prevent coronavirus from spread besides hand washing or hand hygiene?
So it's very important that all of the viewers know that there are several things that you can do to protect yourself from getting infected. The first we've already mentioned. The first is hand washing, and there are several steps to hand washing, making sure that you use soap and water and that you get all of the different surfaces in your hands and your thumbs and both sides. The second thing is respiratory etiquette, we call, which basically means, like, if you have to cough or you have to sneeze, you do it in a flexed elbow. It's really important that you do that, otherwise you're sneezing and those particles can move. If you don't do that, then you can also sneeze or cough into a tissue, and then make sure that you dispose of that tissue into a closed bin and then wash your hands. The third thing that you can do is be informed. So right now, this is a new virus, as we mentioned, and so we're learning information, we're learning about how this virus spreads and every day. And so you need to know where the virus is. You need to know if there's new guidance that's out there that comes from either WHO or from your doctors or from national guidelines. And to be informed, you need to go to accurate sites. There's a lot of information that's out there that's not good, unfortunately, which could be dangerous. So you need to know where you can get the right information and accurate information every day. You can come to WHO website. Or you can go to your National Ministry of Health or Department of Health's website to get the most up-to-date information on this outbreak, this pandemic.
Thank you, Maria. We are also advising some people to stay at home, and as I mentioned, most of our colleagues are working remotely. Why is that important, and how does that help to stop coronavirus from spreading?
So the way that staying home helps is twofold. First, we recommend that anyone that's feeling unwell, in general, if you're feeling unwell, stay home. It's a good rule of thumb. Give yourself some time to recover, regardless of if COVID-19 is around or not. Stay home for a few days. That's good. If you're feeling unwell and you have trouble breathing, you have to make sure that you call your doctor right away and you seek health care, because that's one of the signs for COVID-19 where you need medical attention. But what we are doing now here is most of our colleagues and most of the businesses have closed, and so people are working from home. And the reason that's been put in place is to keep people apart. So the one way that you can prevent yourself from getting infected is not being in contact with other people who may have this virus. And so if you have a physical distance, we sometimes say social distancing, which we really should call physical distancing, because what we really mean is a physical separation from one another. Shouldn't touch your face. A separation from one another, but you can still remain socially connected. TikTok is a great way, as well as other different technology, so that you can still feel connected with other people, but be physically separated from another person. If I could just say, don't touch your face.
Thank you.
Just don't touch your face. It's amazing how often you touch your face. I'll have to come back and look at this TikTok and see how many times I almost touched my face or actually touched my face. Your hands, have dirt on them, and if you don't wash them regularly, you can contaminate yourself. So make sure you try to avoid touching your face, especially your eyes, your nose, and your mouth.
Thank you, Maria. Thank you for mentioning TikTok, and as well, we are using several social media platforms to keep connected with public from around the world and inform them on how to protect themselves, and also on our work and new guidance. We're receiving questions, and we thank you very much for that. So the question is coming: who is the most vulnerable to COVID-19, and is it more dangerous for people with asthma?
So we do know from data from a number of countries that people who are most vulnerable for developing severe disease are people of older age, so people who are over the age of 60, 70, and 80 years old, but also people who have underlying conditions like chronic respiratory disease, like asthma, or cardiovascular disease or diabetes. So those individuals who do get infected have a greater chance of developing severe disease.
Thank you, Maria. Speaking of staying at home, somebody was asking, is it dangerous to go out to shop and do some shopping?
So there's a lot of national guidelines that are out there now that are recommending people to stay home. So it's important that you follow the guidance of the national authorities. If you're recommended to stay home, you should stay home. And if there's ways in which you can do delivery, if that's possible, then use that type of services. If you do have to leave your home, you can go shopping, but you have to follow the same fundamental rules. Wash your hands, use an alcohol-based rub, don't touch your face, practice respiratory etiquette, and stay apart from other people. The virus is not in the air, so it's not that you walk outside or you walk into a grocery store and you can get infected. You have to physically either have it on your hands and touch your eyes, or someone has to spread it through those droplets.
Thank you, Maria. Here is the next question. Should I be taking precautions with my pets, or can I still pet them?
You can still pet your pets. I mean, pets offer a tremendous comfort to everyone that has a pet, and so yes, you can still hug your pets.
Thank you very much, Maria. Somebody is asking, should we wear masks and gloves?
So in some cultures, many people do wear masks. Our recommendation at WHO for people in the general community is not to wear a mask unless you yourself are sick. And if you're sick, you should be at home. But if you are sick and you're in contact with other people or other family members, you can wear a medical mask, so one of those surgical masks or medical masks. And what this does is that this protects you from infecting other people. But what we really need to do is save the personal protective equipment, including masks and gloves, for our frontline workers, for healthcare workers who are caring for patients in hospital. They're the ones that need this PPE, and globally, if everybody were to wear a mask, we really run into some trouble. So please save those masks for the people that really need it.
Thank you, Maria. You mentioned for people who are staying at home and asking, is it safe to go shopping, that they may do online orders if possible. So there is a question I think would be good to clarify. Is it safe to order online and receive packages?
It is. It is safe to order online and receive packages. Some people are concerned that the virus may live on surfaces for long periods of time, but it doesn't last for very long on surfaces, and it can be cleaned through disinfectants.
Thank you, Maria. I just want to mention to our TikTokers that most of these questions are coming into our Mythbusters, how we call them. So you can follow our website. We are updating these regularly. So you may find some of these responses there as well when we are not live.
Can I say something?
Yes, of course.
I wanted to say something about the social distancing and staying from home. A lot of older people are going to be at home as well. And so it's really important that, especially the younger people, and I understand TikTok may have a younger audience, if you have your grandparents, parents or grandparents that don't use technology well, I can speak for my own parents, teach them how to use the different channels, whether it's Skype or FaceTime or whatever it may be, so that even if you're physically separated from people, you still have an emotional connection. So be patient with your parents and grandparents, I'm talking to myself here, and teach them how to use it. Because this will be with us for some time, and people will need to stay home for some time, and we need to still find ways to remain connected with our family and our friends.
Thank you, Maria. Here comes the question again about physical distancing. Is it safe to meet friends?
So this is a good question. So the safest thing right now is to stay home. The safest thing right now is to not congregate, not group with your friends. That means not socializing in a traditional sense. Maybe you can socialize over social media, you know, and you know, give a toast to each other that way. But it means no play dates. It means no dinners. It means, you know, a lot of recommendations that are coming from many governments are the bars and the restaurants are closed, and that's because we want to keep people separated from one another. So, you know, we can plead with the audiences here just to be patient and to, you know, suffer through this a bit, and we will all get through this. It's going to be difficult for some time, but we will get through it. But really try to adhere to the recommendations.
Thank you very much, Maria. Somebody is following up back on grocery shopping and asking, should I disinfect my groceries?
Well, you don't need to disinfect your groceries. You need to wash your vegetables and your, you know, as you normally would. But as long as you, whatever you touch, whatever surfaces that you're touching, as long as you wash your hands afterwards, you're killing the virus that could potentially be on your hands. So just make sure that you do that and you will be okay.
Thank you, Maria. As we are new on TikTok as WHO, and maybe not all viewers are familiar with what is WHO doing in general, would you explain what is WHO's role in this outbreak and how are we supporting countries and people to stop coronavirus from spreading?
So the World Health Organization that we both work for, I'm based in our emergencies program, so the WHO Health Emergencies Program, in which we have two major groups. We have a preparedness group and we have a response group. My background is in emerging infectious diseases, so these high threat pathogens that spill over and cause outbreaks every now and then. And what we do is we develop prevention and control programs for known pathogens. When we have a new virus, when we have an emerging pathogen, what we do is we work with governments, we work with all countries and all people to better understand what is this virus, who is most at risk, how is it transmitted, what can we do to protect ourselves, and what can we do to control this outbreak. And so what we do is we develop technical guidance around the area, all of these areas. How do you detect cases? What type of lab procedures do you need to have to be able to test people to say if they have COVID-19 or not? How do we treat patients? How do we develop risk communication and community engagement activities? How do we protect healthcare workers in terms of providing infection prevention and control measures? And so my team works on the development of guidance that we give to countries to implement all of these things. We also work with countries to help them in their management and control of an outbreak. I spent 2 weeks in China with a big team of WHO Chinese colleagues where we were working together to better understand this outbreak. And we were there to learn from China to say, what are you doing to control this so that we could teach those learnings to other countries. So we bring people together, WHO will bring people together under different technical disciplines. We do this a lot through teleconferences, and right now we can't do that through face-to-face. So we can learn about all of the different aspects of this virus, turn that knowledge into guidance, work with countries to see how they can bring this outbreak, this pandemic under control.
Thank you, Maria, for very good explanation of what is our mandate and what is our work. Earlier you mentioned that this virus will be with us for a while and we will go through it together. So can you just explain from these experiences that who are overcoming slowly the virus?
The countries that
the countries, that there is a hope for all of us that we can actually do it and fight it together.
There is hope. There is hope, and I hope, I want all of the viewers to feel a sense of hope. Some countries, the situation may get worse before it gets better, but it is really important that everybody feel a sense of empowerment, that there's something they can do individually. There's a number of countries in Asia, particularly China, Singapore, and Korea, that have had really bad outbreaks. And they have now turned a corner. And what I mean by that is case numbers were growing, and they implemented a comprehensive set of measures to be able to control this. And in doing so, and taking these really aggressive actions, and by all of the people in their countries knowing what their role is in fighting this virus, they've turned a corner. And so now case numbers are declining. And in China, the case numbers are very, very low now. And for us, this gives us hope that you can control this virus. It depends on what countries will do. It depends on the actions that we will take. This is the first pandemic we've had in history that we can potentially control, depending on the actions that countries take.
Thank you very much. I just wanted you to share that message with our viewers because there's a lot of fear and panic around it, but it's important to know that we know how it can be controlled.
Yeah. I mean, fear is normal. I think people need to understand that that's perfectly normal. What we don't want is panic. I've seen a lot of videos of panic buying, people going out and buying huge volumes of supply. Please don't do that. Please get what you need. And make sure that there's enough for everybody. But fear is normal, but it's important that we turn that fear into something positive, and we turn that fear into action, into something that we can do. And please help each other. If you can't grocery shop yourself, or if someone in your neighborhood can't, and you can go to the store for someone else, offer to do so. Leave the bags outside of their door, but do little things that can help one another, because we are all in this together.
Thank you very much, Maria. We're getting more questions coming, and one is about symptoms.
Okay.
Can you explain the symptoms and who should a person call when they notice symptoms?
This is a good question. So because COVID-19 is a respiratory disease, it's difficult to distinguish between COVID-19 and influenza or the common cold. The typical signs for COVID-19 are fever, a dry cough, and shortness of breath, difficulty breathing. You may have some other signs and symptoms like aches and pains. Very few people have runny nose or as it relates to COVID-19. I mean, many people have runny nose in this time of the year in the Northern Hemisphere because of flu season, but that's not a common feature of COVID-19. So look out for fever, dry cough, and shortness of breath. If you have fever, cough, and shortness of breath, it's important that you call your healthcare provider immediately and seek care. But give them a call beforehand so that they know that you're coming and that they can prepare.
Thank you, Maria. What should I do if a person I live with seems sick?
If there's a person in your household that's sick, have them call your doctor. Give your doctor a call and explain what they're feeling, what kind of symptoms they have. But a doctor will also ask what kind of underlying conditions does that person have, because it's important to just not look at the symptoms, but also look at their age, look at their underlying conditions, and then the doctor will give advice on what to do. If you're generally feeling unwell, it's a good rule of thumb to stay home, But if you do have shortness of breath, it's important to go in and see someone. But give a call first before you head into the doctors.
Why is it important for people first to call?
So that's a good question. What's important for people to call first is because you need to have that advice of whether or not to go into a healthcare facility or not. What we don't want right now is a lot of people who don't need medical care to go into a healthcare facility and overwhelm the healthcare facility. But if you have any doubt at all, call your doctor right away and get medical advice. Don't take medical advice just from us right here. Make sure you speak with your own healthcare provider because they know about your background, they know about what medications you may be on if you have underlying conditions. But what we want to do is prevent a large number of people who don't really need to go into a healthcare facility from doing so that we save those hospital beds and those that time for the people who really need it.
Thank you, Maria. Someone is asking, are the symptoms in kids different or the same?
This is a very good question. So this, as I said, this is a new virus, so we're still learning a lot about it. What we know about the virus in children is that children are infected and children can be infected, but they seem to be infected at a lower rate than adults. We don't know why, but the children that are infected tend to have more mild disease. Not universally. We do have some examples of children who have had severe disease, and one child has unfortunately died, and this child died in China. But so far, overwhelming majority of children that are infected will have a mild disease, which will be similar to what you would see in a mild disease in adults. So they'll have a cough, they'll have a fever, they may have some aches and pains. They may also have some gastrointestinal symptoms like diarrhea or vomiting, but a small proportion.
Thank you, Maria. More questions are coming in. One is, can you get COVID-19 twice?
So I get this question a lot. So again, it's still a new disease. We're about 12 weeks into this pandemic, which is very early. And what we're learning about people who have been infected is that they can be infected and have symptoms for a few weeks, and then they can recover. But they can still be PCR positive. They can still show evidence of having this virus for some time. The question is whether or not they can be reinfected. We don't believe so, but we need more tests to be able to look at the immune response in an individual, and those are called serologic tests. Those are looking at an immune response. Those are new, and we don't have full data on that. So I don't have a complete answer to that yet, but we don't believe so. I'll have to get back to you when we have more evidence on that.
Thank you, Maria. Based on current evidence, do we have information on mortality rate? Is it only happening in older people or it can happen in younger? You mentioned that unfortunately one child died, but what is the current evidence we have?
So when we look at mortality, we look at how many people have died based out of the reported number of cases. And so usually we give a percent that'll say 2 to 4% of people have died. There's a problem when you say that because when you calculate that, you calculate the numbers of deaths over the number of people that have been infected. And what that bottom number doesn't tell you is the number of people who have had mild disease that haven't been picked up through surveillance systems or have had a subclinical infection and would never get picked up through a surveillance system. So when we look at the total number, or the extent of infection in the population, it's likely that that percent number will go down. What we can say is that mortality is higher in older adults. It's higher in people who are 60, 70, 80, above 80 years old. And it is higher in people who have underlying conditions.
Thank you, Maria. Question is coming, and we've been receiving this a lot as well. What's the difference between flu and COVID-19?
Right, so they're both respiratory, I'll tell you what's similar first. They're both respiratory diseases, they're both viruses. They both cause a range of disease from very, very mild to death. The difference between the two is how it spreads. Well, they both spread by droplets, but in flu, the main driver of transmission, which means where circulation is happening most, is in kids. And we don't see that with COVID-19. And COVID-19 spreads faster. So the time between someone infecting someone who infects someone else is much faster than influenza.
Maria, somebody is asking, how long do the symptoms last?
Well, that will depend on a number of things, but we know that people who have mild disease, from the time that they develop symptoms to the time that they recover is around 2 weeks. For people who have severe disease, it may be a little bit longer because they're in hospital so it'll be maybe 3 to 6 weeks.
Thank you, Maria. Someone is asking, how is the test done? Do they take blood sample or how does it work?
They use what looks almost like a Q-tip, and they put it in the back of your nose, really high up. It's a little bit uncomfortable, it's not painful. Or they do it in the back of your throat. So it's a swab. We call this a nasal swab. And then for people who are in hospital, they may take a lower respiratory sample, but that's only if you're in hospital. And then they test that. But it's not, this for PCR testing, it's not a blood test.
Thank you, Maria. Somebody is asking, what about people with immunity disorders? And I think you mentioned that earlier, but maybe just to summarize again, who are the most vulnerable to COVID-19?
So from the evidence that we have, the people that are most at risk for severe disease are people with underlying chronic disease, cardiovascular disease, people who have diabetes, people who have cancer. I don't think I mentioned cancer before. So people who have immune deficiency, yes. What we don't know yet is what this virus will do in other types of populations. So right now, the majority of transmission is in Asia and in Europe. We're seeing it in North America. We're seeing some starting of circulation in Africa and in Latin America. What we haven't yet seen is how this virus transmits in high levels of HIV population or in malnutrition children. So this is a worry that we have because we want to make sure that we protect as many people as possible. So if I could just say that in protecting yourself from infection, you're actually preventing onward transmission. So not only are you helping yourself, you're helping other people. And this solidarity is something that we really need. So the fact that you may be young and healthy, if you prevent yourself from getting infected, you may prevent infecting a vulnerable person. And that's what's really, really key. So every person has a role to play in this pandemic.
Thank you, Maria. And here are a few last questions. Does COVID-19 affect pregnancy? Can the baby get it? Do we have any evidence on that?
So we do have some evidence of COVID-19 in pregnant women. And from the data that we have, it doesn't seem to cause a different disease in pregnant women as it would in the same aged woman who's not pregnant. So that's good news. And we haven't seen transmission go from a mother to the fetus. And so that is good. We've just recently put out some updated clinical guidance for adults, and which also include pregnant women. So that's on our website for the clinicians out there.
Thank you, Maria. And someone is asking, is it safe to fly these days?
So it's all about what you do wherever you are. So whether you're on an airplane or whether you're going to the grocery store or whether you're outside of your house or at work, it comes back to the fundamental aspects of protection. Hand hygiene, wash your hands with soap and water or an alcohol-based rub, respiratory etiquette, and keep your distance from people, and be informed. So know what's happening, know where this virus is. I've seen a lot of flights canceled, so also be patient, with as we sort of navigate ourselves through this tough time.
Thank you, Maria. Thank you so much for your time. Thank you for informing our viewers how they can protect themselves, but also how by protecting yourself, you're protecting others. And it's important that we are all in this together and act in solidarity. And it's also important that we know that there is something that we as individuals can do as well to support the efforts of scientists, medical workers, especially health workers on front lines, and governments who are trying their best, doing their best to try and control coronavirus. Thank you very much once again. Thank you, TikTokers, for watching us, and please keep following and watching our videos. We'll do our best to have more often of these live sessions with our experts so that you can ask them questions directly. Meanwhile, we will try to provide as much as possible our information in some interesting videos. And don't forget to wash your hands or rub your hands and join our Save Hands Challenge. Until next time, goodbye from the World Health Organization.
Hello, my name is Nika Alexander. I'm a communications person here at the World Health Organization. Today we're going to talk about clinical management for people who are sick with the new coronavirus, with the novel coronavirus. I won't be doing most of the speaking. It will be my colleague, Dr. Janet Diaz. Janet, do you want to introduce yourself?
Hello, everyone. My name is Janet Diaz. I'm the team lead for clinical management at the WHO Emergency Program.
And so clinical management means how you care for a patient who's sick, right? It's the treatment. So this could be a very specific kind of conversation we're having today for healthcare workers, but we want this to be interesting both for healthcare workers and for the general public. So hopefully it will be of interest to anybody who wants to learn more about this disease, but it really is more about that specific topic of how patients are cared for. So this is a new disease. I want to timestamp this a little bit. We're recording this on the 1st of February. At the moment, there are 12,000 cases of the disease in China, 12,000 cases in China, and 130 cases in 23 other countries. So it really is centered in China at the moment, but people are working together to learn more. So how do you learn more about a disease which at this point is 1 month old? We've only known about it for 1 month.
Well, it's a challenging situation, but with the WHO, we have established a global clinical network. So we are in touch with at least twice a week, but more so by email, on a large teleconference calls with clinicians that are actually caring for the patients, clinicians from China, from Wuhan, from Shanghai, as well as clinicians from France and the US and the other countries that have been caring for patients. And it's an opportunity for everyone to share what it's like to care for those patients, what they're doing, what they're presenting with, what their symptoms are, what their complications are.
And so what do we know? What have you learned so far?
So it seems that at large that the disease leads to a mild illness. So most patients are mildly ill, which means they have maybe a fever, cough, sore throat, muscle aches. But there is a percentage that does get severely ill. We think it's about 20%, but we will see those patients go on to develop severe pneumonia. They can also develop dehydration, respiratory failure, which means that they would need a breathing machine to help them continue breathing, and there have been deaths.
At the moment, what we understand from Chinese authorities is about 2% of the people for which they have information, 2% of the patients in China have died. Is that about right?
Yes.
Okay, so that, again, timestamp for this time. This is 1 month after we've known about the disease, and information may change and evolve as time goes on.
Exactly. I mean, I think for those, there's patients that remain in hospital, so we have to see what their outcomes will be after being in the hospital.
So that you just summarized what we do know. So for most people, it's a mild disease, about 20% severe, and about 2% have died. What do you not know? What are the questions you're trying to get answers on?
Well, we also have an idea that those that have died with disease tend to be of older age and have chronic other medical conditions, such as diabetes. But we would like to have a better understanding of that, so that's what we need to know. So truly, what are the risk factors for severe disease? What are the risk factors for death? We also need to know what treatments would work, what antiviral treatments would work for this novel coronavirus.
At the moment, there is no specific treatment. There's not an existing medication that you can pull off the shelves and say, this works for people who are sick with nCoV, with the new coronavirus.
So with this new coronavirus, we have no known effective antiviral therapies. There are some that have potential, we think may work, but we have no known effective antiviral therapies.
So what do you do? What are these doctors that you're speaking with in China and elsewhere, how are they treating these patients?
So because the patients that are mild at large, that they have self-limiting disease, which means they get better with some time, so they get treated with symptomatic treatments such as paracetamol for fevers. For those that get sick in hospital, then they require supportive care treatment. So this may be on the hospital ward or in the intensive care ward. That would mean if you have pneumonia and you need oxygen therapy, you get oxygen therapy. If you need IV fluid therapy, you get intravenous fluid therapy. If you are suspected to have an infection, a co-infection, so in addition to the novel coronavirus, a bacterial infection, which can happen, then we give you antibiotics. And if you develop respiratory failure, you go on mechanical ventilation.
So I just want to be really clear on this antibiotic side, because this is a virus. You can't treat viruses with antibiotics. But as you said, if the person has this virus and a bacteria, you give them the antibiotics to treat the bacteria.
Exactly.
Okay. What are we doing then to find a specific treatment?
So WHO is working nonstop with global experts. We have the R&D blueprint, which is accelerating research during outbreaks, and they have assembled multiple also meetings, teleconference meetings with global experts on research. And there are two main outputs that will come out of that. One is the prioritization of potential therapeutics. So based on the evidence, what therapeutics that are out there or in pipeline, in development, should we use in a clinical trial? Yeah, focus on, use to treat patients. And the second aspect is a development of a master clinical trial protocol, which is the best way to test new therapeutics for efficacy and safety.
So for a general public, I just want to simplify the language a little bit there. You said WHO has an R&D blueprint. It's like a group that works on research and development, if that sounds right.
Yes.
And then what is a clinical trial in this context? I think before I came to WHO, I thought a clinical trial was about chemicals and pipettes and whatnot, but it's actually establishing a way of some patients treated with this, some patients treated with that, and then comparing their outcomes, or how does a clinical trial work in this context?
Yeah, I think what you've described is true. So what we are doing with the global experts is developing a master protocol which has clear protocol on how you use these new therapeutics, because they need to be tested. Patients will get randomized into one treatment group or another treatment group, depending on what the final protocol determines. And
that's about how it works. And consent's always a question people wonder about as
Oh,
well.
of
If
course.
someone's in a trial, do they give their agreement to be part of that? But these trials are always reviewed for ethics, and there's a consent.
Oh yeah, so
component as well for
any
that as
clinical trial has informed consent involved in ethics approval at the country level. So we're in the early phases, so we're developing the master trial protocol with global experts.
Okay, that's the stage we're at now. We're going to wrap up soon, but what would be your advice, Dr. Diaz, for healthcare workers who are watching and who are interested and want to know what to do if there's a patient or they think somebody might be a patient with this disease in their healthcare setting?
So I think to start off with, it's important to get familiarized with the WHO website. It has a lot of useful technical guidance documents to inform about the disease and how to treat the disease and how to prevent the spread of disease. For those of you that are actually healthcare workers or if you're a patient, I think the most important thing is to recognize a potential person that may have novel coronavirus. We have the case definitions on the website, so you can read those and you post those in the clinic, and then if you suspect someone may have the virus, then quick action is to isolate and prevent further spread of the virus, and we have guidelines on that. And then if someone is very sick with the virus, with the severe complications, then initiate supportive care treatments like I described before.
So this is for healthcare workers. We're not saying members of the public should be identifying people who are sick, and I say this is really for health workers.
I think for members of the public, if you develop a fever, cough, or shortness of breath, then you must seek medical care, and advise if you have traveled to the affected areas.
Yeah. Thank you. So that's, at the moment, as we said, the 1st of February, when we're recording this with the knowledge we have now, the outbreak is mostly in China. The vast majority of cases are in China. The cases in other countries have a travel history or link to China, again, mostly. And as Dr. Diaz said, for the focus is really on people in China to listen to what the national health authorities are saying, and when you should go to a healthcare center versus staying at home, because sometimes the disease is mild. And then for people elsewhere in the world, fever, cough, and difficulty breathing, you should seek medical advice on what you should do next. Is that a good summary?
Yes.
And you mentioned that more information can be found. That's at who.int. We're improving the website, adding more information as we go along, but there is information for if you're traveling, protective advice for yourself, and there's a lot of guidelines for ministries of health and health workers and so on. So thank you so much for watching today, and thank you for being with us. One thing, actually, one more I should add is that this is a more of a general kind of discussion we had, but we're also developing, WHO's developing courses and has more detailed information really for healthcare workers that is more specific and really meant for you and to help you in your work. Thank you very much, and check back often for more information. Bye-bye. Thanks again.
Thank you.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
Welcome to WHO. This is an opportunity for you to ask the questions you want answered about the COVID, the disease caused by the new coronavirus that has caused outbreaks in a number of different countries. I'm Dr. Margaret Harris, and I'm here today with Dr. Maria Van Kerkhoff, who's our expert in coronaviruses and respiratory diseases, and is here to explain what you can do to protect yourself. Over to you, Maria.
So hi everybody, thanks for having me. Yes, I'm with the World Health Organization, and I'm the technical lead for this novel coronavirus outbreak called COVID-19, which I'm sure you've heard a lot about.
So I'm going to ask Maria a few questions, but we also offer you the chance to ask your questions via Facebook and via Twitter. On Facebook, I'll give you the way to ask your questions. You can do it via the comments section, and on Twitter you can ask your questions by using the hashtag AskWHO. So Maria, what can people do to protect themselves if they're in an area where there's currently an outbreak of COVID?
So thanks, Margaret, for this question. This is a really important question because there's many things that you can do as an individual to protect yourself and to protect your family against this novel coronavirus. The first thing is very simple. The first thing is to wash your hands regularly. And it sounds very simple, it doesn't sound very exciting, but it is incredibly important that you make sure that you wash your hands with soap and water, and make sure you get your kids to wash their hands as well. And if you don't have soap and water, you can use an alcohol-based rub. That's the first thing. The second thing that you can do is what we call as practicing respiratory etiquette. And what that means is when you sneeze or if you cough, that you do that in a folded elbow, and you sneeze or cough into your elbow, or you use a tissue, and then you throw that tissue away, and then you make sure you wash your hands. And the third thing that is really important is to educate yourself. So make sure that you have the latest information about novel coronavirus, about COVID-19 from your parents, from WHO, from trusted sources, and make sure that you know what the latest information is about this. This is a rapidly changing situation, and every single day we are learning more and more about this virus. And so the more we learn, the more we want you to know about this. And by educating yourself, by knowing more about this, you can make sure that you protect yourself and you protect your family.
But it's not so easy, really, to always wash your hands, to keep those hands clean. And there's another secret, isn't there, Maria? How does the virus get into your body? Whereabouts is it getting there?
So yes, washing your hands is difficult, and it is something that you have to do many, many times a day. And as a mom myself, I know I tell my kids all the time to wash your hands and wash your hands regularly before you go to the bathroom, after you go to the bathroom, when you're cooking food, before you cook food, after you eat your food. You have to do that many, many times a day. But this is a respiratory virus. This is causing respiratory disease, which means that many people have signs and symptoms like the common cold almost. They'll have a fever, they'll have a cough. Some people may have shortness of breath, which means that their chest hurts a little bit and it's hard for them to breathe. But what we know about this virus is how it transmits between people is through close contact and through respiratory droplets, which means you have to be close to one another within a meter or two, which is 3 to 6 feet. And if I were to sneeze right now on you or cough on you right now, I would pass some droplets to you. And those droplets could go into your eye, they can go into your mouth, into your nose. So you have to make sure that if you do cough, you cover your mouth so that those particles, those droplets, those little droplets don't actually infect someone else.
So when should people be wearing a mask?
So that's a good question. So there's a lot of people, WHO recommends that you wear a mask if you're sick. So if you have respiratory symptoms, what you do is you wear a mask, and there's important ways in which you put the mask on and off, and we have some good videos that show a proper way to put it on and off. But you're using a mask to protect other people. So if you have symptoms, and you wear a mask, then you protect yourself from getting those droplets onto other people.
And what happens if you're, say, coughing into your mask and it gets very wet at the front?
You need to replace your mask. And so this is a hard one because we do see a lot of people wear masks and they re-wear them. So it's important that you take them off from the sides. You don't touch the front. You take them off from the sides, discard them, wash your hands, and put another mask on.
And when you discard them, you would make sure that you discard them somewhere safe, that's covered?
That's right, in a bin that is covered. Yes, that's right.
So we have quite a few questions, a lot of questions pouring in. Thank you to everybody who's watching and asking brilliant questions. I'll start with one from Casey Carmichael. Thank you for your question. You're asking, why don't you recommend longer quarantine than 14 days? Is this because are there false negatives and outliers? Should we have a quarantine longer than 14 days?
So thank you, Casey, for that question. That's a good one. What we recommend is for when you do contact tracing that you have to identify the cases, you identify their contacts, and then you follow them for a certain number of days. And the important number of days has to do with what we call the incubation period, which is a big fancy word that basically means from the time that you are infected to the time that you develop symptoms. And 14 days is the upper end of the incubation period that we are following. We believe that most people will show symptoms after infection about 5 or 6 days after they are actually infected. And yes, there are possibly some outliers of some upper numbers, but what we look for when we try to find that number is we look for case pairs. So if I'm a case and you are one of my contacts, then we follow you for a certain number of time to determine how long it takes for you to develop symptoms. And that's actually very hard to do in an ongoing outbreak. So we are constantly looking at data that's coming from countries. And as of right now, we feel very firm and confident that 14 days is the right upper bound.
And you mentioned symptoms. What symptoms should people be looking out for?
So the symptoms that you should be looking out for are respiratory symptoms, so signs and symptoms. So a cough, a dry cough, shortness of breath. Very few people actually have a runny nose or sneeze. I've just recently returned from China. I've just spent 2 weeks in China working with incredible colleagues that are working very hard to really understand this outbreak. And what they've learned from more than 70,000 cases in China is that very few people actually have runny nose or actually sneeze. Most people will have a fever. Most people will have a cough, and then some people will feel generally unwell. They'll have maybe some muscle pain, and what we do worry about is anyone that has shortness of breath or chest pain to make sure that they seek health care very quickly.
That's great. Now we have another interesting question from Andrew Maki, Orfanidu, and I apologize if I've got your name incorrectly. Is there any chance we'll have tests available in a mass way so that people don't have to wait for hospital testing? I think you're referring to point-of-care tests that can be done very quickly.
Yeah. So thank you, Andrew. That's a good question. So right from the start of this outbreak, we've been working very hard. The whole global community has been working very hard to have tests available. And these are called PCR tests. These are molecular-based tests, which basically you take a swab, a sample from some of your upper respiratory passages in your nose and a little bit further down your throat to be able to quickly determine if you have COVID-19 or if you have something else. Very quickly, within a week of identifying this outbreak, this cluster of pneumonia in China, Chinese authorities shared a sequence. And that's the RNA, that's the blueprints of what this virus is. And by doing so, they were able to help the entire world, including China, but other countries as well, develop these tests so that you can actually determine if someone is infected. It usually takes, it depends on where you are in the world, but it usually takes a matter of hours to maybe a day to get your results back. And so in some situations, that's just too long. So we're working very hard to make sure that we have what's called a point-of-care test or a bedside test so that you can have a really rapid, within minutes, test result. We're not quite there yet, but there are a lot of virologists and laboratorians who are working hard to make sure that those tests are done quicker.
Thank you. That's really good news. Darren Tay wants to know if COVID-19 is airborne.
So Darren. So thank you, Darren, for that question. So no, COVID-19 is not airborne. COVID-19 transmits via droplets, and what we mean are these small little particles of moisture, liquid. And these particles, when they come out of your mouth, they drop. And so that's why we say between 1 and 2 meters. Anything beyond that, and they don't disperse. So no, it's not airborne. But the one thing I should say is that in healthcare facilities, what we tell our healthcare workers, and I just want to say how grateful we are to all of the healthcare workers who are working to treat patients, particularly in China, but not just in China. We know you're on the front lines, and we're very grateful for all of the hard work that you are doing. We do tell healthcare workers that when they are treating patients, sometimes they have to do procedures on very sick patients where they have to intubate them. And sometimes you have particles that could be dispersed much further than just that 1 to 2 meters. And so in those situations, we tell healthcare workers, you have to use airborne precautions. And so there may be some confusion out there when we say airborne precautions. Those are for healthcare workers performing very specific procedures, but for every day, no.
That's great. The next question is there any association between the flu and between this COVID virus? So
that's a very good question too. I get that question quite a lot. So COVID-19 is not influenza. It is a respiratory virus, and so it's very difficult to determine in the early stages of illness of whether or not you have flu, or if you have COVID-19, or if you have another respiratory pathogen that's circulating around. But it is not flu. And the reason we know this is because we know it transmits a little bit differently in terms of, who is most affected, who has the higher risk of being infected. It's a very serious disease, as flu is. And so for COVID-19, the majority of people, about 80% of people who get infected with COVID-19 will have a mild disease and will recover. but there is about 20% of people that will go on to develop severe disease and will require some advanced care in a hospital. But like I said, I've just come back from China, and what we learned there, one of the really most important things that we learned there is that many people who have had severe disease are now going on to recover. So it doesn't mean that if you have a severe disease that you will die. It means that you will get the right care in a healthcare facility, and you have a good chance of survival. So that is very good news.
And would you say that people who get severe disease start with what looks like a mild disease but become ill, so getting to care early will help them?
Yes, and we do know, yes, so when you begin, when you are infected, you do start out with a mild disease. What we look for are what we call risk factors for severe disease. And what that means is, like, are there certain individuals that have maybe some underlying medical conditions, or who are maybe of older age, that have a higher risk of developing severe disease? And we know that people who are over 60, people who have underlying disease like cardiovascular disease or an underlying respiratory, a chronic respiratory disease, diabetes, they have a higher risk of having a severe disease.
Okay, we've got another question that I have certainly seen come up in all sorts of places from Casey Carmichael, who asks, can virus particles survive inside packages?
So that's a very good question. We've seen that a lot, and we actually have that on our Mythbusters, which is on our website, which is trying to address some questions that many people have. So there are some studies that are ongoing right now that look at virus survival. And so what that means is, how long can you actually detect a live virus on a surface, and for how long? And so these are some preliminary studies. We don't have the full results yet, but what we know from other coronaviruses like SARS and like MERS is that on packages, on certain like cardboard materials, that it doesn't last very long. And so no, so it won't stay viable, it won't be alive, the virus won't be alive for a very long period of time. What is important, though, on certain other surfaces like plastic or like in healthcare facilities, that the virus can be inactivated or killed, if you will, by disinfectants. And so as I'm sure everyone has seen, when you clean your house, you clean in healthcare facilities, it will inactivate the virus.
And you're talking about any kind of disinfectant?
Normally ones with bleach.
Okay.
So in our guidance materials, we have some details on what that actually means. How many parts bleach versus how many parts water. But yes, since some bleach would be good.
So if you want to know more about disinfectants and disinfecting your surfaces, go to the WHO site, go in and look at the guidance. You'll find it under coronavirus, and you'll find all that information there. Now, Sarah Lubitsch asks, how can individuals find out if there are cases near them?
So Sarah, that's an interesting question. So I've seen, I don't actually know a good answer to that. What I can say is that I have seen in some countries, they use a lot of data, big data, and they have ways in which you can see on a map if there are cases nearby you. I haven't seen that here in Switzerland, where we're based, but I have seen that in some other countries. But I think if you're concerned, like I said, educate yourself about what is happening around you. Watch the news, talk to your parents, talk to loved ones, talk to your healthcare provider. If you have some concerns, make sure that you address those concerns and you get some good answers. And there's a lot of good information online, but there's also a lot of bad information online. So make sure you check the WHO website, and you can see we have situation reports that we put up every single day, and so you can see the latest information that we have.
And correct me if I'm wrong, but even if you have, say, somebody in the next house who's ill with coronavirus, if you're doing all the sensible things to protect yourself, if you're washing your hands, cleaning your surfaces, you're going to be all right, yeah?
Yeah, that's right. It's not in the air, circulating around like that. And I think if I could just take this opportunity to say, in the last few weeks, what I've seen in China is this overwhelming involvement of the community. Everyone is involved in this fight against coronavirus. And that is really powerful. So I want everyone watching this to know that you can do something about this. What we mentioned in the beginning of washing your hands, sneezing into your elbow, educating yourself, you can take control, and make sure that you protect yourself and you protect your families. And everyone in China is really working towards fighting this disease. And that is really a wonderful thing.
Oh, there's another interesting question here from Nuriyati Agus. If we've already got influenza vaccination, will that protect us from coronavirus?
That's a good question. So unfortunately, an influenza virus will not protect you against COVID-19, but an influenza virus will protect you against influenza. So that is very important. There are vaccines that are in development right now for COVID-19 and for coronaviruses. And these coronavirus vaccines have been in development actually for many years, starting with SARS, which is severe acute respiratory coronavirus, and MERS, which is Middle East Respiratory Syndrome coronavirus. Now, what scientists are doing is that they're taking the work that they've done for those pathogens and trying to use that to build vaccines for COVID-19. So they're in development, they're not ready yet, but we are working very hard with many partners to try to push that and make that happen a lot quicker.
And so then we have another interesting question about treatment from Louise Vaughan Harris. She asks, if a person contracts COVID-19 and then it goes to pneumonia, will they be treated with antibiotics, or will it be treated differently because it's a viral pneumonia?
So that's a good question. So, so as I mentioned, the majority of people who are infected with COVID-19 will have a mild disease, which may actually include a mild form of pneumonia. And so normally you're treated based on your symptoms coming in. Antibiotics will not work against COVID-19 because that's a virus, but I know that you could have a co-infection with a bacteria, and an antibiotic may be helpful for that, but it won't actually work against a virus. Antibiotics don't work against viruses, unfortunately.
So we've got another question which is interesting. It's a little bit about testing, and you've explained, but Carolina Gomez wants to know, what's the procedure for detecting whether somebody's got coronavirus? What do we need to know?
So the first thing is about what you can do. And so WHO recommends that if you're feeling unwell, just in general, you stay home for a few days. But if you have symptoms that have fever and have a shortness of breath in particular, make sure that you go seek healthcare early. And in that case, you would talk with your healthcare provider and you would tell them what you've been doing, tell them how you're feeling, and they will ask you some questions. And they will probably ask you where you've been in the last 14 days. And so if you've been recently to an area where there is COVID-19 transmission, I think it's important to say that COVID-19 is not everywhere in the world. It's in certain places right now. It's in China. We have seen some cases in Italy and in Iran and in other locations in Korea and Japan, but it's not everywhere. And so your healthcare provider will likely ask you, where have you been? And then they'll take a sample. And it's usually like a long Q-tip, and you're a doctor. There's a long Q-tip, and they'll it's a little uncomfortable, but it's not painful. It's not painful, and they'll take a sample, and then they'll do a test to see if you have COVID-19.
And that test, as we said, might take a while because they have to do a quite complex test in the laboratory.
In the laboratory,
but
yes.
But you'll know within about 24, 48 hours.
I believe that's the typical time frame, yes.
But normally, again, if we're concerned that somebody has COVID, they will probably be asked to stay in the hospital in isolation at that point?
If you're positive, yes, then you will be, I'm sure, admitted for care and making sure that we give you the best care that we can.
Sajid Ali asks an interesting question. He wants to know whether there are reinfection. Do people get reinfected? Have we seen this?
That's a very good question. I'm not aware of people being reinfected with COVID-19. What we know is that people who develop this disease, they will be sick for some time, but for a matter of weeks. But then when they recover, I have not heard of anyone being reinfected with COVID-19, but we have to remember this is very early days of this outbreak. This outbreak was detected on December 31st, and we're 7 weeks, or I don't even know what even the day is today, but it's 7 weeks. It's very quick. So there's a lot of knowledge that we're accumulating every single day. And so that is one of the questions that we have, and we will be looking for answers towards that in the coming weeks.
So, and we'll be appearing every day, so you'll be able to find out more. We've got the big question I've heard many times comes from Joy Flores Corpus. What about asymptomatic transmission? Is this occurring?
So this is also a very good question. So what we know about people who are infected with this virus, as I mentioned, most people will have mild disease, some people will have severe disease, and some people will die. There are individuals who have very, very mild disease. And some of them will shed virus, which means that they can transmit to other people. We are aware of case reports, so some individuals, a small proportion of individuals who are, I wouldn't even say asymptomatic, but pre-symptomatic, meaning it's a few days before they develop symptoms themselves. And many times when we go back and we talk to them, we find out that they truly weren't asymptomatic, which means no symptoms at all. And so when you go back and you interview them, oftentimes they say, well, actually, I wasn't feeling very well. So it's this pre-symptomatic phase or mildly symptomatic phase. Having said that, it is possible, and we do have some case reports of truly asymptomatic people that can infect, but we don't believe that they play a major role in transmission. We believe that people who are symptomatic are the ones that are transmitting the virus to others.
So it's rare but possible.
It's rare but possible. It's very rare, yes.
And
not
again,
a major, we say not a major driver of transmission, which is a fancy way of saying we don't believe that they're the people who are most important in transmission.
And importantly, they're not the people to fear either.
Right.
That, And when you mention pre-symptomatic, you mean really in the early stages, maybe the first symptoms are just feeling like a train hit you, feeling exhausted and aching, but wondering if you just overdid it the night before.
Right, right. That's right. Yeah, that's right.
So we've got a few questions about temperature now. Casey again, but it's a good question, so you get another question, Casey Carmichael. What will it do in warmer temperatures versus colder temperatures?
What will the virus do in warmer temperatures versus colder temperatures? Well, we are learning about what this virus can do in different countries. And so I think again, this is one of the good questions that we're starting to accumulate some knowledge of. You know, there's a lot of cases in China. You know, I don't know the percentage today of how many cases are in China compared to the rest of the world, but it's the vast majority still. And there's some colder climates there. I was in Beijing recently, but I was also in Guangzhou, which is more southern part of the country, which was much warmer. And so you do see transmission. It's too early to say if temperature, in terms of outside temperature, has anything to do with virus circulation. But we need to prepare ourselves that this virus can transmit between people anywhere that it goes. And so you need to be ready, and you need to make sure, again, I'm going to say again, that you wash your hands regularly with soap and water, and make sure that you wash thoroughly, or you use an alcohol-based rub. You make sure that you practice respiratory etiquette, where you sneeze into your elbow or cough into a tissue and throw that away, and make sure you keep yourself educated. Know what's going on in your area so that you can better protect yourself and your family.
And on that, yes, we're getting quite a few questions about traveling. What should you do when traveling? Chiara Maioni says, should we wear a mask when traveling? She mentions that she knows that this only helps people already infected not to spread it, but does it help preventing it?
So there's a lot of things that you can do to protect yourself while traveling that have to do with COVID-19 but have nothing to do with COVID-19, and that is making sure that you travel when you're well. You know, you're feeling well, you and your family, making sure, again, you wash your hands a lot, you practice respiratory hygiene, making sure that when you eat food, you know, you're eating cooked food, or that you wash food, making sure that it's washed before you consume them. We recommend wearing a mask when you yourself are ill, and so just wearing a mask in general, no, but making sure that if you're having symptoms, respiratory symptoms, that you wear a mask.
And we have another interesting question from Kia from Ethiopia. How many, what's the rate of infection in children? Are many children infected?
So hi Kia, that's a great question, and one of the big concerns of many that we have about COVID-19. There was a really big report that came out of China, I think it was last week, where it was looking at 55,000 cases that had occurred in China, and very few were among children. I think it was 2% of those infected were among children. And that's a very low number. And that's important to know, because in flu, for example, children are really important in transmitting this virus. But in COVID-19, they don't seem to be. We don't know why yet. And so that's a big point of research and to help with our understanding of what that actually means. But even the children who are infected, many of them will have mild disease.
Okay, well, that's reassuring.
Yeah.
Another question that we've certainly had before, and I know we've got on our Mythbuster site, but it's an important one. Can it be passed on from pets and also from chickens? Marilyn Drysdale asks.
So I'm not aware of any evidence that this virus transmits between pets and people, and people are looking, and so there's a lot of investigations that are underway. They have not found this virus in an animal yet, in the zoonotic source of what we believe initially, that this outbreak began with people who were in contact with wild animals, not pets. But we have no evidence of this virus in pets, and no evidence of this virus transmitting between pets and people.
And what about chickens? I guess chickens are pets too, of course.
Chickens are pets too, or chickens.
Or
so
chickens,
yes.
Okay. A lot of people are asking about treatments. Have we got any treatments? We know we're doing a lot of studies, but have we seen any medicines that seem to be helping people recover more quickly?
So as you just mentioned, there's a lot of studies that are underway. And so when we have an outbreak like this, it's really important that these studies are done the right way. And we call these clinical trials. And they have to be done in a way that we look at the appropriate use of that treatment compared to some others. And we don't have results from those yet. But in China, there's more than 100 clinical trials that are ongoing. Some are using Western medicine and some are using traditional Chinese medicine. So we were just in China and we were asking about these questions. And so we know of a number of questions that are being investigated in patients, with patient consent, of course. But we don't have results of those yet. So hopefully very soon we will have some results that we can share.
Here's an interesting question from Praveen Ganapathy. What about swimming pools? What would be the best... Praveen asks two questions, but we've already talked about bleach-based cleaning agents. Praveen asks about that, but she also asks, what about using swimming pools?
Well, that's a very interesting question. I think you can use swimming pools just fine. Many swimming pools have chlorine in them, and we haven't heard of any transmission happening in swimming pools that I'm aware of, and that's a good question, but I'm not aware of any transmission happening with relation to swimming pools.
And it is happening in places where there would be swimming pools, right?
Yes, of course. So a lot of these types of questions, these are really good questions that you're asking, so thank you for sending them in. We try to get answers to those through what we call epidemiologic studies. And what we look at is we talk to people who are infected and people who are not infected, and we say, what did you do? And ask the same questions to the people who are not infected. And through those types of investigations, we learn what are called risk factors for infection.
Right.
And so what we look for are travel history, what type of jobs you may have, what types of exposures you may have had in the 14 days before you got sick. So those are the types of risk factors that we would look for, but swimming pools are not one of them.
Okay. And in fact, it's probably good to ask, what are the risk factors you're finding? Anything specific?
No, not yet. So what we're looking at right now, the risk factors for severe disease we know are these underlying medical conditions that I mentioned earlier. So the cardiovascular disease, diabetes, underlying chronic respiratory diseases, older age, those put you at risk for developing severe disease.
And now we've got an interesting one from Khaled El Hatib. Should we stop our kids from going to school?
Oh, so that's a very good question. And as a mom of two myself, I can understand where that question is coming from. So it depends on where you live. Right now, a lot of the schools in China are closed right now after the holidays, after the Chinese New Year and the Spring Festival. And some of those schools are going to be opening again soon. And here, where we don't have transmission, it's perfectly safe to send your children to school. Yeah.
And here's another question. I'm not quite sure who it's from, I'm sorry, but it's what action should we take if a work colleague has a fever and is coughing but refuses to seek medical attention and continues working?
Well, the first thing to do is talk to your colleague and just ask them how they're doing. Have a conversation. Just because you have a fever and a cough doesn't mean that you're infected with COVID-19. That's really important. It's also flu season. So there's a lot of people around who have the sniffles, who have a cough, who have a fever. Talk to your colleague. Find out how you can help them. What's important is that they seek medical care, especially if they have chest pain, if they have difficulty breathing. And then the doctor will ask them, where have you been in the last 14 days? And that will trigger maybe or not they get a test for this COVID-19.
And at this time, do you think people should be having conversations with their employers about if an outbreak occurs, where they are, can they work from home? Are there other ways in which they can work while not necessarily being in the office?
Yeah, that's a good idea. I mean, just having conversations with your families, express your concerns, talk to your employers, and just see what your plans are. It's very important, and we talk to everyone in the world about getting ready. What would you need to do if this virus were to show up? How can you make sure that you continue to be able to work? And there's a lot of ways in which you can work from home, if that's possible with your type of job. But talk to your families. Express your concerns. Don't hide them in, because there's a lot of good information that is out there that can help educate you on what this is, and even more importantly, what it isn't.
Exactly.
Yeah.
And on that, again, a lot of people have young children, so we're seeing quite a lot of school closures, and people then have to stay home because they have to look after their children. So again, this is something you would recommend discuss with your employers now. What are you going to do?
Yeah. Yes, this is a conversation that needs to continue to happen. As I mentioned earlier, this situation, this outbreak is evolving very quickly. We're learning all the time new things about this. Please come back to the WHO website and look at what we have posted. There's new postings every day, whether there are situation reports, which gives you an overview of the latest cases and what WHO is doing. There are myth busters. There are videos that can help you, teach you about, like I said, how to wash your hands, how to make sure you wear masks appropriately, and many other things. But please do continually read about this and look at the websites and make sure you have the latest information at hand.
Now, at Diagonals wants to know, the question that many want to understand is, how can you tell the difference between just a common cold and the coronavirus?
So in the early stages, you can't. In the early stages, it's very difficult. But what we say is, if you're in an area where this virus is circulating, it's important to either call your medical facility if you're just feeling generally unwell. But as I mentioned, if you do advance to having shortness of breath, make sure that you seek health care immediately and say what you've done, say where you've traveled. And then the only way to distinguish is through a test. Yeah.
I just want to say, I can't believe people are watching us from all around the world. We've got people from Angola, UK, Vietnam, Peru, Indonesia. The list is so long.
It's wonderful.
I'm so glad and excited, but that's what we're here for, to share information and to answer your questions. And I've got another interesting question. Can it spread through drinking water?
Not that I'm aware of. No, it cannot spread through drinking water. As it spreads through close contact and through droplet, as I mentioned earlier, but not through drinking water, no.
And it's a repeat of an earlier question, but I think there's clearly a lot of concern, because I've seen a lot of questions about touching surfaces. People are worried about touching paper, plastic and cardboard surfaces. And this viewer asks, do you recommend wearing gloves?
So if you touch many surfaces all the time, all day, and so what is important is that you are able to do that, but that you make sure you wash your hands. So you washing your hands with soap and water will remove any threat that you have there. Just make sure that you wash thoroughly or use an alcohol-based rub.
And here's a kind of related question. Can it be transmitted via aerosol transmission by flushing the toilet? I think the questioner remembers the SARS incident in Hong Kong where this occurred.
So no, not that. That's no. What would be good to do is if you close the lid before you flush the toilet, to make sure that nothing spreads that way, but not necessarily the virus, and making sure that you close that lid and flush the toilet before you go out.
Okay, we've got many, many more questions, but we've run out of time. So we're going to keep on repeating this. Keep a watch, and we will be there to answer your questions. Thank you so much, Dr. Van Kerkhove.
Thank you.
And
thank you everybody.
All for everybody for joining us.
Thank you.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
Hi, good afternoon, good morning, and good evening. Thank you for joining our live today from WHO headquarters in Geneva, Switzerland. We are live today on Facebook, LinkedIn, and Twitter. And we're going to talk about coronavirus or the COVID-19, as you have heard in the news a lot. So the disease have affected people from many countries, and in January 2020, WHO have declared as a public health of emergency. And for this outbreak, we know that we are not only fighting the virus, but we are also managing stigma, fear, and discrimination. So today, I'm sitting here with our mental health expert, Aisha Malik, to talk about why is it important to talk, to understand about the mental health aspect on this disease. So Aisha, can you explain to our audience today why is it important to understand about the mental health on COVID-19?
Thanks, Sari. So, as Sari said, we're not just talking about an outbreak of COVID-19. What we're also seeing is an increase in the anxiety that people are experiencing. So it's really important to think about mental health as part of the public health response to COVID-19. We know that in emergency situations that mental health can decline in the population and that there's a higher rate of mental health conditions. So people who might be vulnerable to experience mental health during this time might include people who have pre-existing mental health conditions or substance use conditions in the community, or who might represent other vulnerable groups who are vulnerable to stress. So we're not just talking about protection from COVID-19, but we're also talking about prevention of stress and fear during this event as well.
Thank you, Aisha. And if you have any questions for Aisha around the mental health on COVID-19, the new coronavirus, send in your question as comment on Facebook and LinkedIn. And on Twitter, you can tweet and use hashtag AskWHO. So Aisha, there's a lot of fear spreading right now around the new coronavirus. Should we actually be scared? Or is it the result of the spread of misinformation that people see in social media, in the news? Can you tell us more about that?
Sure. So fear is a response to perceived or actual threat or danger.